Part 2. And it's going to be presented by Dr. Heather Forkey. Heather is an associate professor of pediatrics at the University of Massachusetts Medical School. And she's also vice chair for wellness for the Department of Pediatrics and division director for the Child Protection Program and Foster Children Evaluation Services of the UMass Memorial Children's Medical Center. In addition to her clinical work, Dr. Forkey has been the recipient of local and federal grants to address issues of children in foster care and to translate promising practices to address physical and mental health needs of children who have been traumatized. She has published and presented nationally and internationally on the topics, serves leadership roles for the National Child Traumatic Stress Network and the American Academy of Pediatrics on issues related to foster care and child trauma. Heather, I'm going to turn it over to you.
Great. Thank you guys so much. It's a pleasure to join you guys again. Let's see if we can advance here. I don't have anything to disclose financially. Today, we are going to talk about the role of the affiliate response in preventing burnout and secondary traumatic stress. And in that regard, we're going to pick up where we left off when I had the opportunity to be with you guys back in September. We're going to talk about the vagal and autonomic nervous system stimulation and how that impacts symptoms that we see, and try to develop a strategy to promote the affiliate response individually and for the organizations we work with. You know, I think in any conversation around medical care, we're talking about burnout and secondary traumatic stress as being the elephant in the room. Certainly now in this waning, hopefully, days of COVID, this is a bigger issue than it's ever been before. And I want to just take a minute to make sure that we're all on the same page with what we're talking about when we talk about burnout and secondary traumatic stress, because there are a lot of terms that are used in this space and they all have slightly different meanings. And so just for the purposes of today, burnout is characterized by emotional exhaustion, depersonalization, and the reduced feeling of personal accomplishment. This one is work-related as a result of general occupational stress. It's not used to describe the effects of indirect trauma exposure. And in fact, that is what we are seeing when we talk about secondary traumatic stress. And those are the presence of PTSD or post-traumatic stress disorder symptoms caused by at least one indirect exposure to traumatic material. There are other terms that are used instead of secondary traumatic stress. The one that comes closest is compassion fatigue, which may be a less stigmatizing way of talking about it. And I would say that in medicine, we've begun to talk about burnout, haven't really brought in secondary traumatic stress as completely as our colleagues in mental health and even in some other areas like child welfare have started talking about that. But of course, if we're seeing these symptomatic conditions, there has to be something underlying it. And as I mentioned back in the fall, when I was asked by my institution to consider this and think about it for our faculty, I was looking at sort of the literature, which was beginning to suggest solutions. And I was struck by the fact that we kind of skipped a step, especially for those of us who do medicine, because we really had not talked about, or I couldn't find much in the literature around what was happening to people biologically and physiologically, right? So as people began to talk about solutions, which were largely the individual solutions, I was struck by the fact that you would only know if those worked if they were addressing the underlying physiology. And as I began to look into it more completely, I realized that what we were talking about had a lot to do with the stress response. I deal with kids who've experienced severe stressors. And so talking about the stress response is something that I'm constantly doing. And as I began this work, I was struck by the fact that we, nurses, team members, family, we're all dealing with the same stress responses that our patients do. So there's the freeze response, that sort of deer in the headlights response. There's the fight or flight response, which is to run away or to turn around and try and fight the predator. But for humans, none of those are actually particularly effective. We're too big to freeze effectively and not be noticed by predators. We're too slow. We don't have claws. We can't hide underwater. So fight or flight doesn't work that well for us. It's got some benefits, but not really over the long term. So as humans, we evolved to have another response, which is the most effective for humans, and that's called the affiliate response. And it turns out that under threat, what humans do first and best is we turn to each other and we see, hey, are there other humans here who can help me deal with this problem? And if you can find those humans to help you, you bring them to you, and that helps to manage the threat. As I mentioned in the fall, this is mediated by oxytocin rather than norepinephrine or cortisol, the way fight or flight is mediated. And what oxytocin does is it actually increases your social salience. And what that means is that under the conditions of this oxytocin surge, you actually get better at looking left and right to see if the people around me are safe, if I can turn to them and they're going to help me, or are they the folks who are going to hurt me? And it turns out that if you look to people and they can help you, you identify that and you have pro-social thoughts and actions. You facilitate that support from others. And that allows you to develop these adaptive stress responses. We as a group will handle this threat together and we will manage it, and that will actually help shut down the rest of our stress response. But as we talked about in the fall, what happens when you look left and right and you find that the context or the situation is unsafe? In medicine, we're finding that the context is often not safe, that we are dealing with health organizations that are often impersonal. We lose our sense of autonomy. There's often a big focus on productivity and finances. Performance is measured by cost, not how well you do your work with other humans. How fast we sign our notes, how fast we empty our inbox. And often these organizations are using things like shame, posting who's the best and who's the worst. And on top of those organizational things, there are top-down factors that are impacting us, things like regulations and administrative burdens, cumbersome EMRs. And I will say that on this topic, I think many people feel like there's some leadership failure, that they have no voice and that there isn't a sense of flexibility to adapt to what makes sense for the people who are working in these institutions. And so all that put together means that you recognize this context as unsafe or negative, and you develop antisocial or defensive thoughts or actions that protect yourself. And those lead to distress responses, because now the people who were supposed to help you fundamentally want to eat you. And so you can't use them to be your support. And so you are shoved back along this stress opportunities that all you have at your fingertips is fight or flight or freeze. And that has some significant consequences. But one of the things we didn't talk about last time is, how does that switch happen? And it turns out that it's actually automatic and, as it turns out, autonomic. You know, when we are recognizing that we are under threat, we're not making a decision. We're not sort of consciously saying, oh, this situation appears to be unsafe or not supportive of me. It is a perceiving of threat that's been labeled neuroception. You're drawing in information through your senses, and that information is being processed at a subconscious level at the autonomic nervous system. So stress arousal and recovery turns out to be a big part of our autonomic nervous system's role. And it serves as that bridge between the brainstem, which is, after all, this most primitive part of our survival brain that controls stress arousal and recovery, and the rest of the body. And in particular, the vagal nerve has a huge role in this. I mean, if you think about the vagal nerve itself, it has a ton of fibers. Remember, in medical school, this was the one that was super hard to remember because it had so many different functions, right? It had afferent fibers that were sensory. It had visceral afferent fibers. It had special afferent fibers for taste. It had afferent fibers that went down to your cardiac organs and your abdominal organs, your thoracic organs. And what was that about? And it turns out that we as humans have a very particular skill. We can use tend and befriend, and we're going to want to use it preferentially because it's the most effective. And what that means is that we are the only species that can be in conflict and stay engaged. And it is the vagal nerve that is largely responsible for our ability to do that. So think about, maybe even today, this morning, you came into conflict with someone in your household, maybe your partner or maybe your kids. And you didn't just kind of go into fight or flight or rage. You tried to stay connected with them, right? You tried to continue to have the conversation, even though it was a stressful one. And that was happening because the vagal nerve was allowing you to do so, right? You actually had some alterations of your facial tone, your muscles, your vocal tone, and that allowed you to stay what we call socially engaged. The other thing that was happening is that the vagal nerve was providing what's called the vagal brake. It was sort of pushing on and impacting other organs that were allowing you to stay calm and in the moment. So let's see what was happening. You have impact. That vagal nerve is right there. It's cranial nerve 10, and it's right in contact with all the facial nerves. So it's allowing you to use your head, neck, and eye muscles to make eye contact, to use your facial muscles to make minute changes, to stay socially connected. Think about it. If your teenager rolled their eyes at you, they were actually doing something that was incredibly threatening, and you tried not to look away or scream. You tried to stay connected. That meant that you had to control your vocal tone, not start shrieking. You may have also taken a deep swallow, which is part of how we calm ourselves down. You were listening to the tone. You were trying to monitor your own vocal tone, but you were also listening for sounds of safety, sounds that the other person had mollified or come to a less aggressive stance. Similarly, the vagus nerve was doing something else. It was impacting your heart rate. It was trying to help you slow your breathing. And it allows you to release acetylcholine so that when you recognize that, okay, the threat is diminishing, you can relax your muscles, you can digest, you can heal, you can grow new tissue, and you can rest. So this vagal nerve has a huge function. And so what's happening under constant threat, such as COVID-19, is that you are constantly being assaulted by these things that you perceive as threat. You're looking to others for support. You may not be finding it, but you're constantly trying to apply this vagal brake. Stay socially engaged, and you're pushing on the brake. And although this is a far too gross analogy, it's like overriding and riding your brakes in your car. Eventually they wear out, right? You can't continue to do this infinitely. And so what happens is that if you ride the vagal brake, you eventually bust through and you wind up going back into fight or flight. There's nothing more you can do. But now you have lost the ability to restore this homeostasis and the things that allow you to rest and heal and calm. So this chronic activation of stress means that you're not using this vagal brake effectively, not tapping on it to sort of slow you down. And your cardiovascular, your immune system, your digestion, your ability to rest, your ability to grow, your ability to heal are all impacted negatively by this constant impact of that perceiving of threat. And so what that means is that what happens in the vagus doesn't stay in the vagus, right? It has consequences all over the place. And if we're having difficulty managing stress and arousal, now we're actually also going to have trouble using Tend and Befriend in an effective way. So let's start at the top of this sort of vicious circle. You have this chronic exposure to stress, a la COVID-19. You are chronically trying to stay engaged, but you've now pressed on the brake too much, and you are now no longer effectively using your vagal brake. That means you push over into fight or flight, and this now is wear and tear, not just that's sort of more constant. What that means also is that you can't access the supports of others to manage the threat. You actually become less effective at reaching out to others. You can't maintain relationships to manage that stress. And so around and around we go in this circle. Other researchers have called this the window of tolerance. Your ability to press on that brake to continue to stay engaged is your window of tolerance. And over time, constantly being threatened and stressed, your window of tolerance closes. And many of you may have found that you are quicker to snap. You are quicker to disregard the other person's opinion. You're quicker to make you may have been slower to judge before. And so understanding this begins to bring back some individual solutions to how we can start to recover. And those of you who know me know that I have probably a pathological desire to use mnemonics. And so I've created one called You Are It, which helps you to think about this reaction in the moment, which is to understand, as you have today, learn that these responses are normal. And as you're going through these interactions with people, recognize where you are in that process, and that gives you the choice and ability to shift. I will point out to you that although autonomic functions are largely been below our subconscious control, we can control it. Think about how many times you've tried to suppress a yawn, and you know that you can bring it to consciousness and you can try to manage it. And that awareness, noticing those physical cues of the knot in your stomach or your heart racing, allows you to say, okay, I'm here now. What can I do to sort of get back and start to vaguely break again? And what you'll want to do is recall what we talked about and use some relaxation skills. So also consider when you have moved from uncertainty or stress in the past and gotten yourself to calm down, and know that you can do it again. It requires some intention. For many of us in these moments, there's some ego. There's a sense of being embarrassed, and you want to let that go. And you got to focus on your intention in that situation and what you want to accomplish. And then you have to trust the process, because staying connected with others, even if it's tough, has this overarching, much larger benefit. So you can focus on your voice, focus on your body language, focus on the things that you can control and manage, and begin to pull yourself out of it. I will say, though, that one of the things that has aggravated me a bit, more than a bit, about burnout and secondary traumatic stress discussions is how much is put on the individual. And I really think that if we're going to be effective in medicine, we have to think more about organizational solutions. And can our leaders lead us out of burnout? We talked last time, I pointed out that 30% of burnout is related to your first line supervisor, that supervisor support has been identified as a way to manage secondary traumatic stress, and that burnout improves if just 20% of your time is spent on work that is most meaningful. So what I think that also says is that the most important affiliate relationships may be with our first line supervisors. For me, there's a parallel with the pediatric work that we do. For children, the most important affiliate supports are with their caregivers, the people that they turn to for safety and security. For those of us in our work life, our first line supervisors are kind of our work parents. They're the people that we're going to turn to first when we need to deal with something that's a threat. And what we need to know is, what are the critical factors to allow that immediate supervisor to help us use these adaptive responses? And I think what it gets us back to again and again is ways to promote, tend, and befriend. What we need to know then is there a list of what leaders need to know to provide and promote adaptive responses? And I think there's always a list. I mean, there's for leadership, for development of people who are going to be supervisors, there's always a list of skills they should develop. If we're thinking along these lines, there's just probably a little bit of a different list that we should be looking at. Whoop, went too far. And so that we can engage those skills. Most recently, there was a paper in academic medicine by a number of experts in burnout. The lead author is Tate Shanafelt, who is probably the #1 author in terms of publications and solutions from an organizational standpoint to deal with burnout. And this paper is called Wellness-Centered Leadership, Equipping Healthcare Leaders to Cultivate Physician Well-Being and Professional Fulfillment. I think it's a pretty useful article, and I'd encourage people to read it. I'm going to give you a high-level summary. They identify 3 ways that leaders should be promoting wellness. The first one is to care about people always. And so I translate that to tending. The second one is to cultivate individual and team relationships, which I translate to befriending. And then the third one is to inspire change, which I actually think is probably a combination of tending and befriending. But here, you come with me and see if you agree. They identify skills that a leader needs to be one that is effective with these 3 main goals. And those include things like inclusion, keeping people informed, humble inquiry, that idea that they are not going to come into a situation as the know-it-all expert, but they're going to ask questions. They're going to develop individuals' skills and empower both the individuals and the team as a whole. Interestingly, they spend a lot of time saying that we really need to focus on intrinsic motivators rather than extrinsic rewards or punishments. What we've seen a lot of in medicine is the attempt to use sort of the posting of who's not getting their records done on time, or applying small bonuses. And for those of us in medicine, these are not necessarily the things that are going to be the most effective. Again, they want to point out that those who show up with curiosity and humility and are open to opinions and opportunities are far more effective than the experts who think they know best. This is kind of a challenge for us in medicine because oftentimes the person who is promoted to immediate leadership is the person who's a really great researcher, is the expert who does know best in a particular clinical area. And so recognizing that in supervising others, that is not something that they can translate as effectively. When we talk about the particular skills, care about people always is one of their big focus areas. And what they say there is to focus on respect, empathy, curiosity, and seek to understand and validate the complex needs and contributions of individuals and teams. And they say to care about others, but really to start with self. And I think that that's a hugely useful tool. It kind of combines this idea that individual solutions and organizational solutions are kind of interwoven. The idea that we need to attend to exercise, nutrition, health, and rest, really kind of allowing ourselves time to re-engage our vagal brake. The role of sleep is brought up in this paper as being probably one of the most significant. And when a leader devalues sleep, there's a huge consequence on others. Those leaders who say, hey, I only need 4 hours, really sort of puts a pressure on people to leave behind one of the most effective tools for getting back to a homeostatic place. And then there's this empathetic concern and capacity for perspective taking that drives leadership behaviors to inspire change and achievements that go beyond expectations. That ability to look at the world with the other person's mind in mind is how we talk about this when we talk about child trauma. And it's so critical for leaders that they are taking the perspective of those that they serve as leaders so that they can look at the world from their perspective. As they do so, they will become better at this second goal, which is to cultivate individual and team relationships. So they want to nurture relationships of those they lead, but also the interrelationships on a team. And that involves this deep respect and understanding that you hired these people because they were good and capable now, not that they're broken and need to be fixed. And that people have this immense ability to grow and improve, particularly people who are at the level, of people who come to healthcare, that they often have this sense of calling. And that if we can nurture that sense of calling, those are the people who are less at risk for professional burnout. I'll bring you back to the concept that I pointed out last time and briefly here, is that we know that burnout decreases if just 20% of your time is spent on something that you find the most important. And I think that that's speaking again to the fact that we want to appeal to people's sense of calling and allow them to approach their work and to do that work in a way that actuates that sense of calling. Inspiring change is allowing the team to think beyond the status quo and empowering them to drive change. It means focusing on those intrinsic motivators, like they're not just financial incentives, titles, and awards, but meaning, purpose, values, voice, and making sure that that is a real high priority for the leader. And some of you will say, hey, well, that's fine and dandy, Forky, but it's not, it's sort of high and mighty goals, like down and dirty here where we work, right here in the clinic. How am I going to measure that? How am I going to look at whether that's being done? And I will turn again to Tate Shanafelt, who came out with a paper in 2015, looking at the use of a tool that they developed for Mayo Clinic, which was a set of questions that people were asked to answer about their supervisor. And interestingly, the supervisor scores in each of the 10 leadership dimensions, and we're going to talk about them, turned out that each 1 point increase in a supervisor's leadership score was associated with a 3.3% decrease in the likelihood of burnout for those they supervised, and a 9% increase in the likelihood of satisfaction. And so I think that all of the things that they have on their list have to do with tending and befriending. So some of them are tending. They hold career development conversations with me, empower me to do my job, treat me with respect and dignity, provide helpful feedback and coaching, recognizing me for a job well done, and encouraging me to develop my talents and skills. The other few are related to befriending. It's interested in my opinion, encouraging employees to suggest ideas for improvement, and keeping me informed about changes taking place at Mayo Clinic. And finally, if we go back to that wellness-centered leadership paper that just came out, The last thing a supervisor should be doing is inspiring, and certainly here that's also being measured, inspiring me to do my best and encouraging me to develop my talents and skills. And so I think what this allows us to do is then consider what you can do as a leader or for your leaders to encourage them to think about what's going on in terms of the normal human stress responses. And that when we see people who are being impacted by burnout and secondary trauma, that what we're seeing is just a manifestation of something that is physiologic and a part of how humans function. And if we apply that knowledge to our workplace, we might have some pretty unexpected outcomes for this elephant in the room. And with that, I will stop